Hello, and thanks for tuning into this month's video blog. Today we'll talk about Madigan Pharmacy Services, a topic which might best be described as a love-hate relationship for many of our patients. Over the last 18 months, our pharmacy team has worked hard to identify areas for improvement, and they've implemented new measures to streamline the process for quicker patient service. I can tell you about those measures from here, but instead I'd like to give you a behind-the-scenes look at the daily operations of the Madigan Outpatient Pharmacy. While one of our top goals is to get you in and out of the pharmacy as quickly as possible, our primary focus is to ensure that your prescriptions are accurate and safe. So come on back and get to know your Madigan Pharmacy. Welcome to the main outpatient pharmacy. Every day, the pharmacy staff fills over 4,000 prescriptions. Whether prescriptions are filled in person at the pharmacy, the refill pickup window, or the drive-through pharmacy, every single prescription is treated as if it is the only one that exists at that time for that particular Madigan staff member. There's a lot that happens back here. After your provider selects the best medication for you, the prescription is digitally transmitted. Once our pharmacy has logged the prescription, the request remains idle until you, the patient, initiate the filling process by selecting a ticket through the ticketing system and speak with our pharmacy technician at the window. For safety reasons, our staff does not begin working on filling a prescription until the patient has requested it to be filled. The time spent with each patient in the drop-off window allows our pharmacy techs to get more information to ensure that your new prescriptions are safe for you to take. Mixing certain medications can be lethal, and it is during these interactions that our team is able to identify any safety concerns that need more attention from the pharmacy or your provider. The actual filling of the prescriptions, the technical and physical steps used to place the right medication with the right dosage in the correctly labeled bottle for the right patient, is the next step in the pharmacy process. The final phase of our pharmacy service is to do what we call show and tell, where our pharmacy technician at the window will show you where you can read the medication information, answer any questions you may have, and they can tell you when and how often to take the medication. Like you, when I'm at the pharmacy, I'm eager to be on my way. Yet we don't want to sacrifice safety and accuracy in order to save just a moment or two of time. Sometimes that may mean you'll need to wait a little longer to receive your medication. However, we are very proud of the fact that over the last year, we have reduced our maximum wait times by over 60%, and over 80% of our patients are finished with their pharmacy visit in less than 30 minutes. As much as I'd like to, I can't promise that there won't be days when the wait time is longer than normal, but we're committed to making your stay as safe and short as possible. One thing that can help with the pharmacy wait times is to avoid using some of the tricks you may have heard about to get through the line faster. Contrary to popular belief, pulling extra tickets actually extends the wait time for everyone. Each ticket number must still be called, and we need to wait about a minute per ticket for the patient to make his or her way to the window. I'm not one for quick math, but I'm sure you can see how much time can be piled up if all of our patients decided to trick the system. I'm asking you, the best patients in Army medicine, to be courteous to your fellow patients and only pull a ticket when you're here to get your medications.
All right, here you go, sir. Here are your medications. Do you have any questions? Yes, sir.
Customer service is another top priority for us here in the pharmacy. Many of you have given us your thoughts on the pharmacy, and it is from that feedback that we've been able to identify areas to improve. I want to thank those of you who have taken the time to complete the Army Provider Level Satisfaction Survey. And I want to encourage those of you who randomly received the survey to complete it and let us know how we're doing. We've made several additions to our pharmacy services, namely the inclusion of embedded pharmacy staff in the primary care clinics. At the family medicine and internal medicine clinics, we have pharmacists ready to assist you with your prescriptions immediately following your appointment. With your embedded pharmacist, you can get the information about the medication your doctor prescribed and initiate the prescription in the pharmacy system before heading to the main pharmacy for pickup. We also have standalone pharmacies at all of our patient-centered medical homes, or PCMHs, like the Madigan Pediatrics PCMH, with quicker and convenient services for parents. The Winder, Akubo, and McCord PCMHs and the Puyallup and South Sound community-based medical homes have pharmacies for our patients receiving care there. Our award-winning Madigan school-based health centers provide certain prescriptions to students at their schools so they miss less class time. And of course, the soldier-centered medical homes have on-site pharmacies for soldiers who receive care there, making it more convenient for their work schedules. With all of these options available to our patients, you're probably wondering what more we plan on doing to improve our services and decrease wait times. Well, for one, we're in the process of getting 2 more ticketing machines. You told us that is something that would improve your patient satisfaction, and we're listening. We're also expanding our formulary to provide more medications for our patients. And as the JBLM installation continues its plans to expand the shopping area on Lewis, Maine, we are scheduled to house a 10-window pharmacy there at Freedom Crossing around fiscal year 18. That would allow us to have more than half our inventory there and save you time. Before I go, I want to reiterate just how committed Team Madigan is to your health, wellness, and safety. Our pharmacy team has listened to your concerns and is working very hard to provide you your medication as safely and quickly as possible. Like I said in the last video blog, I love hearing from patients. If you have questions or comments about today's video blog, please let me know. You can leave a comment on the Madigan Facebook, Twitter, or YouTube pages, and I'll get back to you. As we welcome the beautiful fall season, let Madigan be the first to wish you good health and wellness. I want to thank all of our patients, providers, and staff, and community partners for working together to build a strong and healthy joint-based Lewis-McChord. Take care of yourself, and I'll see you next time. Serving to heal, honored to serve.